Hello everyone, welcome to the latest webinar from our Queen Elizabeth Scholarship Program in Strengthening Health Systems, brought to you by the McMaster Health Forum at McMaster University in Hamilton, Ontario, Canada. For today's webinar, I'll provide you with a little bit of information on the McMaster Health Forum, the Queen Elizabeth Scholarship Program, and the current version of the scholarship that's offered by the forum. I'll then turn things over to our incoming scholar presenter, who's Subhashini. She's visiting us from Malaysia and is going to be talking about embracing evidence synthesis in health policy. Here at the McMaster Health Forum, we aim to be the leading hub for improving health outcomes through collective problem solving. We harness information, convene stakeholders, and prepare action-oriented leaders. We act as an agent of change by empowering stakeholders. The current Queen Elizabeth Scholarship Program is run by a partnership between the Rita Hall Foundation, Community Foundations of Canada, Universities Canada, and individual Canadian universities. The purpose of the scholarship program is to activate a dynamic community of young global leaders across the Commonwealth to create lasting impacts both at home and abroad through cross-cultural exchanges encompassing international education, discovery and inquiry, and professional experiences. The current version of the Queen Elizabeth Scholarship Program that's offered here at the McMaster Health Forum is called Strengthening Health Systems. Our scholars will contribute to strengthening health systems and become part of our large and growing network of health system leaders. The forum's current QES program has had 3 cohorts of students. The first cohort, that you can see on the screen here, comprised students who mainly went away or visited us in the calendar year of 2016. Our second cohort of scholars, which comprised 22 students, primarily engaged in their scholarship in the calendar year of 2017. The third and final cohort of the current version of the Queen Elizabeth Scholarship Program here at the McMaster Health Forum primarily went away or visited us in the calendar year of 2018. Today's presenter comes from the large group of incoming scholars who worked with us in the spring and summer of 2018. Today's incoming scholar presenter is Subhashini, who comes to us from Malaysia, where she's working on her Master's of Science in Health Research through the Royal College of Surgeons in Ireland, accredited through the National University of Ireland at the Penang Medical College. She's interested in how to better translate public health research into evidence for health policy, and Subhashini hopes to strengthen her knowledge and skills in informed and evidence-based health policy decisions. Subhashini, over to you.
Good morning all. I am Subhashini Subramaniam and have been at McMaster Health Forum for the last 3 weeks attending the module on strengthening health systems. I'm very fortunate and would like to thank the Queen Elizabeth Scholarship and McMaster Health Forum for having been given this opportunity. My presentation today will be entitled Embracing Evidence Synthesis in Health Policy Making. I'd like to give a brief introduction on the Malaysian healthcare system. The Malaysian healthcare system is a 2-tier healthcare system whereby mostly is governed by the Ministry of Health in Malaysia, and we have both the public healthcare sector and the private healthcare sector. The Ministry of Health in Malaysia does the most of the governance and the delivery arrangements and the finance arrangements as well. Public healthcare sector in Malaysia provides most of the delivery arrangements, and the private healthcare sector has to take care of their finance arrangement as well as the delivery arrangements. Looking into healthcare policy making in Malaysia, the healthcare policy making in Malaysia has always been assisted by this technical arm called the National Institute of Health in Malaysia. The National Institute of Health in Malaysia consists of 6 other research institutes, which is the Institute of Medical Research, Institute for Public Health, National Clinical Research Center, and Institute for Health Management, Institute for Health Systems Research, and the Institute for Health Behavior Researchers. Apart from these, 2 other units which are specifically assisting the health policy making in Malaysia is the Health Technology Assessment Unit and the Evidence-Based Unit. I work with the National Clinical Research Center, and this is part of the National Institute of Health in Malaysia. So the process of health policy making in Malaysia is normally via an ad hoc selected committee for each proposed policy. It will consist of the member of the parliament non-government organization, expert groups, and group of interest. So what we learned in the module here, the stakeholder meeting, happens to be the first process in the health policy making in Malaysia. After which, just after the discussion, these suggestions will be brought forward to the cabinet in Parliament, and this will be chaired by the Prime Minister himself in Malaysia. Upon approval from the cabinet, only then the financial arrangements for a particular policy will be discussed at the level of the cabinet along with the finance ministry, and then the organization and development for the implementation of the framework, and finally the implementation. So as far as for now, all this year long, Malaysia has adopted mostly primary resource researchers and synthesis of evidence from local and global researchers. However, the the main evidence that we collect from is from the primary resource researchers. I have worked on a couple of top-down research projects whenever a policy is about to be implemented or proposed, the minister or the cabinet will propose to conduct that particular research within Malaysia itself. And that is how we get our evidence based on that outcome to translate it into health policy. However, attending McMaster Health Forum's workshop this time gave me a new perspective towards how we can look at health policy making in Malaysia. And so, as a scholar, I look at myself doing this when I go back. Prior to coming for the workshop, I used to be doing this primary researches for evidence for health policy. I was very much involved in research consultation back home, clinical trials, and top-down research projects. And during the workshop, I have gathered skills of evidence synthesis from the health system evidence database especially. Though Cochrane was quite familiar, now I am more confident of using Cochrane database and the social evidence database as well. A systematic framework in evidence synthesis is something that I have really appreciated throughout this workshop, and exposure to stakeholder dialogues via simulations was a great thing that I learned here. And focused framework for action is also very much needed for Malaysia. So when I get home, I was privileged that I was being able to speak to the director of the National Institute of Health, Dr. Asmaliza. And when I get home, I would do a presentation of report and summary of the McMaster Health Forum's workshop to the director of the NIH, Deputy Director General, and the Director General of Health in Malaysia. I propose to suggest enhancement of the health policy via a core team serving at the level of the National Institute of Health. The core team would then start with rapid responses within the Ministry of Health, and we're looking forward to collaborate with the McMaster Health Forum via the AVIPNet as well. This would be a very big leap for Malaysia in terms of health policy making via evidence synthesis, and I really thank God that I had the opportunity to speak to the director of the NIH, and we would be taking a big step forward by forming a core team which would help in evidence-based policy making from now on. And that's about it. Thank you. I would like to thank a few involved parties, especially the McMaster Health Forum and the staff, the National Clinical Research Center, Dr. Govic Bin and Dr. Muralidharan, National Institute of Health, Dr. Asmaliza, the Ministry of Health in Malaysia itself, the Royal College of Surgeons in Ireland Out Campus, Professor Finian O'Brien and Dr. Umar, and above all, the Lord for giving me this opportunity and my fellow curious scholars in 2018 at the McMaster Health Forum. Thank you.
For those of you who are able to make it here today to watch the presentation in person, I want to thank you for coming out. For those of you that have watched the video later on YouTube, thank you very much for taking the time. Before we leave you today, I just want to take a minute to go over a couple of the links that are on the screen to provide you with additional information about our program and what our scholars have been doing. If you're interested in the Forum's Queen Elizabeth Scholarship Program, either the current program, which is ending in 2018, or the new program, which is actually being launched in mid to late 2018, I would encourage you to please click that first link. That will take you to the information page at the McMaster Health Forum's website and tell you all the information you need to know about our Queen Elizabeth Scholarship Program in terms of how to apply and how to be involved. If you're interested in other presentations and webinars by our Queen Elizabeth Scholars, I would encourage you to click on that second link. There you'll find all of the current webinars that have been done by all of our Queen Elizabeth Scholars, and future webinars that our scholars will be doing will also be posted there. And thirdly, you'll see that there is a link for our scholars blog page, which is machealthforumscholars.com. Our scholars write blogs about personal reflections about their experiences while abroad or when they visited Canada if they were an international scholar. So please visit that page and read some of the blogs that our scholars have posted. Feel free to follow us on Twitter at Mac Health Forum, and please follow the hashtag QE Scholars so you can see all of the fun and exciting things that scholars have been doing from multiple universities around Canada. Thank you for joining us, and we'll hope to see you again soon.